Welcome and thank you for viewing this, the first of two webinars on children's HCBS waivers, home and community-based service waivers. This webinar will look at the specific HCBS children's waivers in Colorado. I'm Christy Blakely. I'm currently the Executive Director of Family Voices Colorado. I'm the parent of an adult daughter with disabilities. I've been involved in advocacy in Colorado for many years and have a passion to support families to navigate Colorado's system of care for children and youth with special health care needs. Also supporting this recording is Advocacy Denver. They are the ARC in Denver County, and we'll go into that more later. Let's get going. I think I need a roadmap. I hear that a lot from families. Often they're asking for a better way to understand the systems available to their children. I too wanted a roadmap years ago, but there isn't a roadmap. So we're hoping this will help you navigate some of the home and community-based service waivers in Colorado. Today, we hope you learn about funding by age, what systems are available and when through your child's journey, Medicaid Basics, and understanding where the HCBS waivers sit in the overall system, how to access home and community-based service waivers through the case management agencies, understanding eligibility and the enrollment process. Finally, we will help you understand the resources available to you in Colorado. Again, this session number 1 lays a foundation for your understanding of each home and community-based service waiver in Colorado for children. The second webinar will help you understand specific criteria and eligibility for each waiver. Funding by age is important to understand that at different ages and stages throughout a child's life, there are different services and programs that become available. From 0 to 3, a child may be eligible for early intervention services, overseen today by our developmental disability system called Community Center Boards, or CCBs. If a child is eligible for EI, or early intervention services, then an IFSP, or an individual family service plan, is written to meet the goals and needs of the child. Plans such as this are especially like contracts with the agency to provide what is identified as the needs the child might have. Also, at age 0 to 3, a child may be found eligible for an HCBS, home and community-based service waiver. If we look at the ages a child is in school, the services for education are written into an IEP, or individualized education plan. Individualized plans are the constant, as each child and youth are different, so no two plans should be the same. From 0 through 21, if a child or youth is eligible for developmental disability services through their Community Center Board, or CCB, they also may access a program called Family Support Services. This program provides funds for the needs of the family not otherwise covered. For example, a night out, we call that respite, or a therapy not covered by insurance. If you're interested in that program, please talk to your case manager in your Community Center Board. As you can see, after age 21, a school is not the service provider, but we may begin to look at Division of Vocational Rehabilitation, as most folks at that age begin to work. DVR, or Division of Vocational Rehabilitation, also has an individualized plan. It's called an IPE, or Individualized Plan for Employment. No matter what system you access, your child will have eligibility, language, terms and definitions, laws which to guide them and identify your rights, procedures or written documents like the individualized planning we were just talking about, benefits or the services offered, and of course an appeals process should you be denied. The history is the basis for what has gone before, what's been approved, what's been denied. But every system has these parameters, so be aware that when you go into insurance, there's going to be terms and definitions different than if you go into Medicaid. All systems are different. When you have a child with special needs and you're hoping to access a service or benefit, be clear. Ask yourself these questions so you aren't working and spending time to get a denial due to missing documentation or need for evaluation. It's better to be ready up front. This may come throughout the individual's life. As I shared, my daughter is an adult. We recently needed a new communication device. I did not think we would need an evaluation, as she's been on the same type of device for many, many years. However, Medicaid required a professional evaluation prior to asking for the device. We had to begin all over again. I want to save you that time and headache. Medicaid in Colorado is called Health First Colorado. Medicaid is overseen by an organization called Healthcare Policy and Financing, or HCPF. I think of Medicaid as a house, and the rooms are different programs. There are doors and windows to access the Medicaid house. For example, you may come into the Medicaid house if your mom was on Medicaid when you were born. That can be called baby care, kids care. You're eligible for Medicaid until you turn 1. Then Medicaid reevaluates the income of the whole house for your eligibility going forward. Other ways to become eligible or get into the Medicaid house are through Supplemental Security Income, SSI, or Social Security Disability Insurance, SSDI. We will not go into those today, but both come with Medicaid as the insurance if you are eligible for either program. These are administered by Social Security Administration, or SSA. Temporary aid to needy families is another program that comes with Medicaid. The HCBS waivers, or Home and Community-Based Service Waivers, are a way for the individual with special health care needs to access Medicaid. Other publicly funded programs are CHP Plus, or Children's Health Plan Plus, for families over Medicaid asset limit. CHP Plus does not have the same benefit package as Medicaid for children, nor is EPSDT a component of the CHP Plus program. We'll talk about EPSDT in just a few minutes. Cover Colorado is another publicly funded insurance program. It provides coverage for people with pre-existing conditions. This program was important to many prior to the Affordable Care Act covering pre-existing conditions. As you can see, Medicaid was created in 1965. It was created to be an insurance for eligible adults, children, pregnant women, people with disability, and the elderly. These are considered an entitlement program and currently covers more than 72 million Americans nationwide. When states decide to offer Medicaid to their population, there are mandatory services they are then required to provide. The cost of the services Medicaid offers is shared by the state and matched by federal funds. The federal government, through Centers for Medicaid and Medicare Services, or CMS, offer optional, flexible benefits to address specific needs by states, sharing this cost as well. The Home and Community-Based Service Waivers are one of these optional services that are created by each state. Just know that each state's optional services and the waivers, or Home and Community-Based Service Waivers, are different in each state. One mandatory service that every state must offer is the Children's Program for Medicaid, called EPSDT. A lot of acronyms in this world. EPSDT stands for early, periodic, screening, diagnostic, and treatment. And it makes sense. If we screen children early and periodically, we may find a problem. If we diagnose or use diagnostic measures to identify the problem and then we treat it, we will save cost. The program federally also tells states to provide for children things that are medically necessary from birth all the way through to their 21st birthday. The children's benefit in Medicaid are richer than they can buy through any commercial health insurance plan. Medicaid is a publicly funded health coverage. It has federal mandatory state plan benefits that are authorized by the Centers for Medicaid and Medicare, and then optional services such as prescriptions, drugs, therapies, and the home and community-based waivers specifically added in Colorado. Let's take a look at the benefits pyramid for Medicaid, which you have seen in other areas and webinars. When we look at these services as pyramid, we can see that the state plan is the most widespread level of services and generally covers the most people. As you move higher in the pyramid, the services become increasingly optional and support smaller, more specific populations with the most intensive needs. Individuals receiving services at a higher level in the pyramid are also able to receive the benefits of the levels below them. For instance, an individual who is receiving a home and community-based service waiver is also able to receive all of the state plan benefits as long as there aren't duplications. Home and community-based service waivers are not the only way for children with special health care needs to access Medicaid House. Colorado has several Medicaid buy-in programs. This one, specifically for children, allows families to buy into Medicaid as if they're buying into an insurance. Based on the Social Security definition of the disability, the child can be eligible for Medicaid if the family income is less than 300% of the federal poverty level. It is best to speak to someone about the financial eligibility, as there are disregards and this limit changes annually. The highest monthly fee is $120 a month. So, for example, if your child has private insurance and say 4 therapies a week, but you pay a copay of $20 each, you would pay out of pocket over the $120 within a month in copays alone. Medicaid has no copays for children. Again, Medicaid has no copays for children. Medicaid also doesn't allow balance billing for clients. So if you have private insurance and you owe 20% of the balance bill, when you come out of a hospital or say are purchasing equipment, you may have quite a bill. If you have Medicaid as a secondary insurance, you aren't billed that 20%. Again, you can save money by having Medicaid as a secondary payer. There are 4 children's HCBS, home and community-based service waivers in Colorado. The children's HCBS waiver created to support children with medical needs 0 to the 18th birthday. For this waiver, you would call a single entry point or case management agency for an intake. Again, the children's HCBS waiver is for medical needs. The Children's Extensive Support Waiver, or CES, as it's known, is for children with high behavioral needs and line of sight care. The Community Center Board, or CCB, oversees this waiver. The CHIRP, CHRP waiver, or Children's Habilitative Rehabilitation Program, is for children at risk of out-of-home placement due to high behavioral needs and possible medical needs. And then finally, the Children with Life-Limiting Illness, or CLLI waiver. For these children, again, 0 to 18, this is for children who have a life-limiting illness and may not see their 18th birthday. When you think an HCBS waiver may be right for your child, there are some things to do. First, speak with somebody very familiar with the HCBS waivers and the differences between each waiver. If your child does not have behavioral needs, then there are clearly 2 waivers that will not meet your needs. Be clear what you do need. Access to Medicaid for the financial reasons I gave 2 slides ago, that may be the reason. Home health care, which may not be covered, or specific therapies under your private insurance. The need of the child should clearly identify which waiver will be best. The children's HCBS waiver requires a letter from Social Security saying your family is over income for Medicaid. You need to ask for an intake for the waiver, but you must know which agency to call that oversees which waiver. Could we make this any harder? There may be a waiting list, as there are not unlimited resources for all of these waivers. Regardless of the home and community-based waiver, I encourage you to keep your private insurance coverage for your child. Kids grow and improve each year, and each year your child is evaluated for eligibility into the program. If you're found no longer eligible, you still want to have insurance for your child by carrying it even when you have Medicaid as a secondary. Secondly, the reimbursement to providers is better through private insurance than Medicaid. Even with private insurance, there's cost savings in no copays and no balance billing if you have Medicaid. In fact, there's a program in Medicaid you may qualify for called HIBI, or Health Insurance Buy-in, that actually will pay for the percent of your child's premium to encourage you to keep your private insurance. The link for HIBI is in a later slide. For each waiver, there are 3 components of eligibility: financial. So until 18, we look at the income and resources of the family. The Human Services or Social Services office in your county is the point of entry. Secondly, the level of care. Case management agencies evaluate the child's level of care for eligibility. The tool currently used is called the ULTC, or Utilization for Long-Term Care 100.2. This looks at activities of daily living: dressing, feeding, bathing, toileting, transfers, and mobility. Targeting criteria is number 3. Again, the case management agency helps identify if the child meets the targeting criteria eligibility. For example, does the child have medical needs for the children's HCBS waiver, behavioral needs for CES or CHIRP waivers? In order to access an HCBS waiver, the applicant, this gets tricky, must think child is living as a single person. So we're looking at the assets of the child for the children's HCBS waiver. The child must have less than 300% of the SSI, or supplemental security income. This is calculated with all the assets the child gets, including child support, Social Security survivor benefits, assets in the bank, or a trust. All income is counted. The level of care eligibility is difficult to understand. The waivers are set up to reduce cost. For example, it's cheaper for the child to live at home than in a hospital. So eligibility is for hospital level of care, nursing care, or care for someone with an intellectual or developmental disability. Colorado doesn't have institutions or long-term care facilities for children. They were closed many years ago, but the level of care the child needs is the criteria for eligibility. HCBS, Home and Community-Based Services, are an alternative to institutional care. Provide institutional level of care to individuals who prefer to live in their home or community. So the Home and Community-Based Service Waiver allows states flexibility to waive certain incomes and eligibility criteria, provide specific services to targeted groups or geographic regions. Home and community-based service waivers can also have waiting lists or enrollment caps, and they provide more choice and independence. For an example, the brain injury waiver, which is for people 16 years and older, you must have a brain injury to be eligible for this waiver. Again, you may qualify for more than one waiver. Looking at the services is one way to identify the waiver which matches best to your needs, but also through the level of care, financial, and targeting criteria for the waivers is where you get the eligibility. There are 24 single entry points that provide case management for specific waivers. This slide shows you that the brain injury waiver, the children with life-limiting illness, and other adult waivers are under the guidance of the single entry points. There are 20 community center boards in the state of Colorado, which provide case management for CES, the Children's Extensive Support, the Children Habilitation Residential Program, and the Developmental Disability Waivers, supporting living services waivers, which are adult waivers for over the age of 18. The single entry points and/or the private case management agencies that we have in the state, and we'll talk about those in webinar 2. There are 4 private case management agencies provide case management only for the children's HCBS waiver. Here are the links for the single entry points the Community Center Board, and county eligibility. The website for Healthcare Policy and Financing, or HCPF, which oversees Medicaid, is very helpful. This link is to the training provided for long-term care services, which is where the home and community-based services reside. There are both children and adult waiver charts at this link, as well as a webinar and other materials. One item you might find helpful is a flow chart to help parents better understand the differences in the home and community-based waivers. In webinar 2, we'll delve into each of the 4 children's waivers, their criteria and benefits. So if you're interested in a home and community-based waiver discussed in this session, I encourage you to watch the second webinar, giving even more information specifically to each of the children's waivers. You would start the process by contacting your local CCB or case management agency or single entry point. You would ask for an intake for the waiver or waivers you feel best meet your child's needs. The ULTC 100.2 is the evaluation to see what activities of daily living your child needs help with beyond what a typical child of the same age and stage might need. The ADLs are feeding, dressing, bathing, toileting, transfers, and mobility. There is paperwork and then the eligibility, which you get through the mail. If you are denied, there is an appeal process written on the back of the letter and agencies that can help you. Having a child with special health care needs is difficult. I encourage family to keep records, as it saves time and often provides needed information if there is a denial. Keep track of medications in a Word document. Family Voices Colorado has a simple template on their website. Keeping a list of the procedures and hospitalizations will help you down the road. I created a care notebook with the areas of medical needs for my daughter. In a simple 3-ring notebook, I added evaluations and any documents to the notebook. So when asked, I would have what I need and wouldn't have to spend time looking. Keeping a mileage log in your car is another way to save time and money. Tracking mileage to doctors, therapists, and other medical appointments can really add up. I always will tell you to get your denial in writing. The reason is if you don't have a written denial, then you do not know the reason for the denial. Also, the date of the denial impacts when the appeal process starts. The timeline is very short. So if you are told no, that it isn't covered, you must ask, may I have that in writing? Otherwise, you didn't get an official no. Medical necessity is the key to accessing healthcare today. Your insurance provider defines it. Most often, it's in your insurance materials. Medicaid defines it, and interestingly, EPSDT, or Early Periodic Screening, Diagnosis, and Treatment, defines it also. Medical necessity is the decision-making by which we get almost all healthcare today. So, if you have a need, you must be clear about why and how to prove you need the medical service. Family Voices has a letter of medical necessity template on its website, which may help you to be clear about the item your child needs. Let's use an example to make things clear. If I need a special bed for my child, I need to demonstrate why a typical bed won't work for the child. What medical difference is there in the bed I want versus the one I have? I need to demonstrate why a typical bed won't work for my child. What is the medical difference in the bed I'm asking for versus the one I have? I need to share all the things I've tried. I need to communicate that with this bed, there will be improvements medically, perhaps even cost savings with the right positioning. I even need to share that I have looked at other beds, and this one, though it may be more expensive, will provide safety more so than the other beds and may even save money. It is tricky, but things that convenience the caregiver are not considered medically necessary. Again, EPSDT is important to understand. It goes up until a child is 21. Ask your provider about EPSDT screening while doing your child's well check. EPSDT, or early periodic screening, diagnostic, and treatment, also gives us the wiggle room for things children with special needs may require if it can be found starting again. Again, EPSDT, or early periodic screening, diagnostic, and treatment, is important to understand. It goes up until the child is 21 years of age. Ask your provider about the EPSDT screen while you're doing the child's well check. EPSDT also gives us the wiggle room for things children with special needs may require if it can be found medically necessary. Here is EPSDT's definition of medical necessity. We all spend many hours on the phone. I have a notebook and try to keep track of who I'm calling and why, plus the date and time. There is nothing worse than waiting on a call for 20 minutes to be disconnected. If I speak to someone, I always ask their name and a callback number. I often ask to speak to a supervisor if I feel the person is not giving me enough information. The supervisor is there, trust me, or the person wouldn't be on the phone. Having this information can be powerful. I recently helped a mom who had called and called. She had spoken to people and the problem continued to not be resolved. When I asked if she had had a list of who she'd spoken to and dates, she gave me everything, people, names, numbers. I shared that with Medicaid and her situation has been resolved. Don't underestimate the power you have to make change. Remember at the beginning, I told you there's different languages and different systems. Healthcare is no different. There are similar terms, but based on whether you are dealing with Medicaid or your private insurance through your work, be clear on language. Today, we are becoming more health insurance literate, but there are many terms to understand in healthcare. Just don't forget to document. Recording will save you time, I promise. Medicaid rules, just like your policy book in private insurance, is found in volume 8. That's what they call it. It's actually the Colorado Revised Statutes. Here are some links to help you along in finding the actual rules. I warn you now, they're not fun reading. I talked earlier about HIBI, that program called the Health Insurance Buy-In, not to be confused with the Health Insurance Buy-In for Children with Disabilities. Could we make this harder? HIBI, which I mentioned, pays you back the premium percent for your child's health insurance when you keep it after you become eligible for Medicaid. So Medicaid is your secondary insurance, just for the child. It is a program that makes sense, and I encourage you to find out more if you are on or plan to become eligible for Medicaid. The Medicare Ombudsman, who's your advocate in Medicaid for managed care, is listed here too. One resource when you are eligible for Medicaid that you may encounter is called the RAE, or Regional Accountable Entity. These organizations through Colorado are charged to provide case management and support children with special needs, along with many other things. This resource is also to help with transportation, help you find providers and specialists, and many more social services. There are 7 regions of this map that show the RAEs and how they came through the Accountable Care Collaborative. It is a way for Medicaid to provide services to meet the unique needs of regions of our state. Members are enrolled in the ACA, or Accountable Care Collaborative. So if you're in Medicaid, you're assigned to a RAE based on where you live. There are 7 regions in this iteration of the ACC, or Accountable Care Collaborative, which are depicted on the map here. You may not know it, but you have many resources in Colorado. The ARCs are in many counties in Colorado. Advocacy Denver, which is hosting us on this webinar, is the ARC for Denver County. There are ARCs throughout Colorado and will support you in many ways, funded by ARC Thrift stores. Check out your local ARC for trainings and advocacy opportunities. They also help with education. Medicaid Managed Care Ombuds. This is an advocate that can help you with Medicaid managed care issues. Family Voices Colorado advocates and works with healthcare, insurance, navigation, and we are a family-driven organization. I have mentioned it several times. We assist families to advocate for their children. We can help with insurance and problems with Medicaid or waivers. We love to answer questions. Peak Parent Center is our Parent and Training Institute in Colorado through the IDEA or Education Act. They can help you with questions related to education, IEPs for your child, and your rights. HCP or Title V is at our health department. This program is funded through Maternal Child Health and is in your county health department. They provide case management and answer specific questions related to children with special health care needs. Parent to Parent offers a listserv and family support. Parent to Parent is also a family-driven organization. They host a listserv and help connect families with similar situations. They are a wonderful resource in Colorado. You have your RAY, which we talked about. There's Disability Law Colorado, which is our protection and advocacy group. As noted in the previous slide, community center boards, or CCBs, are another one of your resources. We are in hopes you found new information in this presentation. If you have questions or need assistance and are in the Denver County, call Advocacy Denver. If you aren't in the Denver County, contact your local ARC for any help related to people with developmental disabilities. Check out Family Voices Colorado's website or call us with questions. We are happy to help. We look forward to sharing with you Webinar 2.